what Loretta suggested was, she taught me about this concentric circle model that she showed you, the overlapping circles. And we tried that out in a project that's still going on called Witness for Wellness, which was designed to really build a new set of partnerships, a new approach, a new initiative in communities of color in Los Angeles. We focused a lot on South Los Angeles, but it spread out over lots of areas of Los Angeles. And not to go into a lot of detail here, but we worked together in partnership directly with many community members, not leads of organizations, clients in the community, parents, who worked with us on how do we translate what we knew how to do from this prior project to something that really could hold in the community. You see on the bottom, for example, the language we use to talk about research, because demystifying research. You share, you gather information and you share it. You look and you listen. What is the community saying? That, what's evidence-based, from whose perspective? You write it down, you record it, and you share it. That's really basically what research is. And then we had different problems that we worked on, each of which had its own community work group. How do you talk about depression in the community? How do you build the strength in services and in outreach to bring the promise of some of this prior work into the community? And then how do you get the support for it? How do you get the leadership in the community to embrace it and fund it? And we worked on all of those problems.
Well, one of the most important things is the bus. Do you see that big bus there? I know that right now all the yellow buses are back on the road. Hallelujah. You know what I mean if you're a parent. People are putting their children on the buses and sending them back to school. However, what we talk about in fueling our bus, we want to fuel the bus with trust, respect, participation, knowledge, and experience. And that's all partners, all people who are a part of this. And I think that we all know that sometimes people talk over us or around us, but as you can see, Elizabeth made sure that we were talking with, not to, and not for. And I think that's one of the most important pieces. And then the bus is there because it's important. How many people have ridden a bus? Oh, goody, almost the whole room. I know that most of us have ridden the bus. But the bus goes from point A to point Z. How many people have gotten on and off the bus at different points along the way? And then you get back on the bus when you need to, right? Well, this is to tell you that in this project, we are hoping that people stay on the bus. But we know that sometimes that there are extenuating circumstances that might take you off the bus for a week or even a month. But guess what? We want you to get back on the bus. Don't stay off too long. But that's the way we're telling folks, is that you can get on and off the bus. We particularly want you to stay on the bus from the beginning of this project to the end. But we know sometimes that people have to write a grant, they get sick. Hopefully they'll find someone else to replace them when they're sick. And you'll do this. And so that's kind of that model, and I think it's really important that we talk about it. And you see where we're going, right? Down the road to wellness.
And as this model developed, you might say the approach, the lead project for developing that approach was the Witness for Wellness program, especially in South LA. But the broader concept, we started getting engaged all over the place. So,
right?
Yeah. The next, my wife has to approve this one too. But also Jim, I'm not going to explain that to my wife, and Ed, and others who are leaders in the project. So, a whole set of initiatives following this general approach grew up in the Hollywood metro area, which is why the National Institutes of Health, when they funded this project, funded it in both South Los Angeles and in Hollywood Metro, because of that history of showing that the starting efforts were occurring. So we did with Queen's Care, Health and Faith Partnership, and primary care clinics, an effort to improve depression recognition in the community and primary care treatment. We worked with, I think 52 churches worked with us at that time in a project to figure out what could churches do around mental health, what did they do now, and what could they do, what did they want to do, what did they want support to do, what kind of support would they need. And we did a large pilot of child trauma-focused intervention through parochial schools, working with one of the large partners of Queen's Care, Health and Faith Initiative. And then the group that's here from Behavioral Health Services has been involved in a very large set of initiatives to improve depression care and substance abuse agencies, which has become known as the BRIGHT Initiative. And then we've had, over the same period of time, a set of partnered research studies with the Department of Mental Health Services, including the Witness for Wellness project, where they were one of the leads, along with Healthy African American Families and some other work we're doing now on the large Mental Health Services Act evaluation here in LA. So just to give you a sense of that history, there's been an approach. We brought together a community-based approach and some of what we've been doing in primary care settings, and then tried to figure out how to do this partnership more broadly.